Hi everyone, we're glad to see you here and we're very excited. So this is Shaz, the CEO of Integrella, and I'm Itzik, I'm the CEO of Ummanu, and we're here to tell you the story about when a disaster becomes opportunity, the hacking and recovery of the NHS 111 services.
So firstly, thank you for having us. Integrella has been in the business of driving innovation and digital transformation in the healthcare industry for about 15 years. We were fortunate to celebrate that big milestone last year. We've got a huge track record in many of the trusts up and down the country, and I personally am looking after a couple of transformational InterSystems implementations at King's College Hospital in London, and much further north, South Tees NHS Trust. So if you got any questions about those two pieces of work that are ongoing, happy to take questions later. But our background is in integration and data sharing, so we're going to bring those themes together in the talk you're about to hear.
Okay, so Ummanu is a tech company from Tel Aviv, and when we developed our telemedicine platform, we understood that the real challenge in providing telemedicine in high scale is not in the anecdotal session, audio or video, between a specific clinician and a specific patient. For that, there are off-the-shelf solutions like, Zoom, Google Meet, Teams, whatever. The real challenge is to provide an enterprise platform that is simple for the clinician, efficient for the organization, and interactive with the patient throughout his patient journey. So our clients are able to achieve high operational volumes using our system. So we have 500 active clinicians using the platform on a daily basis. In the last 12 months, we provided more than 1.5 million remote consultations, and we expect to finish 2022 with 2 million consultations. Our clients use our platform to provide 26 different clinical specialties. The top three are GP, what we call family medicine, pediatrics, and dermatology. And we do it in a very efficient way, and this is the main issue. So when using our platform, our clients are able to provide 4 to 12 consultations per hour per clinician. Specifically in the out-of-hour urgent care setting, they are able to provide 12 consultations per clinician per hour. Just for you to know, the average number of consultations that a GP in UK would provide for out of hours is around 2.5 consultations per clinician per hour. So this is the number at the minute in UK with current technology. But it's not just about productivity, it's also about quality. So one way to measure quality is in how many of the cases the patient would not need to see a GP face-to-face in the following days. So in 88% of the cases, when using our platform, the patient doesn't go to see a GP face-to-face in the following days, and the remote consultation is sufficient to close the loop. So in the last 18 months, we've engaged the UK market, specifically the out-of-hours segment, trying to better understand the pain points and how our platform is able to solve them. So I would like to tell you a little bit about it. But first, to set the scene, let me say a few words about how the work process is for out-of-hours urgent care in UK. So if someone is not feeling well, he is calling the national number, the 111, and then a health advisor would answer the phone, ask a few questions, do what is called a clinical intake, and decides what's the priority and what's the disposition of the specific case. A disposition could be remote consultation or a home visit, or a physical UTC, urgent treatment center. Then the health advisor would hang up the phone and route the call to one of 46 out-of-hours providers across the country according to the specific region. A clinician working for that out-of-hour provider would then call the patient and give him the clinical service. So the first pain point that we identified in this process has to do with clinicians' productivity. So clinical workforce is in shortage in UK, in Israel, it's global and it's here to stay. When you add on top of it precious clinician time that is used for admin activities, you end up with increased use of agency staff and admin staff that leads to higher cost. So our technology solves this pain point by automating and removing all the admin activities from the clinician. So instead of the clinician going over the waiting list, manually dialing the patient, waiting for him to answer, maybe doing some retrials, we automate all that using autonomous predictive dialer. So the system is calling the patient, putting him in a virtual waiting room, and then all the clinician has to do is click a green button saying next appointment, and the next session starts immediately. We optimize both the clinician time and the patient time. And we know for a fact with our clients in the UK that we are able to improve their clinician productivity by 26%. That's a lot when you talk about clinical workforce and when you talk about waiting times. The second pain point I would like to talk about has to do with patient experience. So from the standpoint of the patient, there are multiple providers involved in providing urgent care. So if you add on that long waiting times, you get patients that are frustrated, uninformed, not knowing who is going to call them and when. So we solve this pain point with automating all the communication management with the patient throughout its patient journey. So we trigger automated notifications and IVR calls, comfort calls to the patient, notifying him about his status throughout his journey. So when the case is open, we send a message, we got your call, you are going to be contacted by a clinician within the next 30 minutes. If there is a delay, we'll send another notification. So the patient is informed, and we know for a fact, again, that in 98% of the cases, patients rated the virtual waiting room service as good or excellent. And the last pain point has to do with clinical safety. So you have long waiting times and you have inconsistent management of cases that would lead to jeopardize of clinical safety. So unlike real clinic where patients just come in and get service, when doing remote consultation, in many of the cases, the clinician can go over the list and pick and choose the specific cases they would like to treat. In some cases, it would be the easy cases, and they override the clinical urgency. So, as I said, when using our platform, they only click the button, they don't go over the list. We manage the list behind the scenes according to the organization's business logic, and we make sure that patients get treated according to the right order. Again, in fact, we help our client hit in 95% of the cases, hit the SLA for urgent cases. So we knew that the system is suffering from these pain points, and we knew that we have the cure. But the big challenge was interoperability. We needed to hook into their current service and radically improve it. And for a commercial constraint, the time frame to do this challenge was 8 weeks, including design of the process, getting NHS assurance, developing, customizing, deploying in AWS. And this was a big challenge, and we couldn't find a more professional and agile partner to do it than Integrella.
Wow. How to follow that. So, yeah, Itzik, it's been a privilege and honor, and thank you for selecting us. We've enjoyed working with you a great deal. We hope to continue that relationship. I will provide a little bit of a health warning. Some of the slides that are coming up are somewhat technical in nature, but this is an InterSystems event, so if you do wish to come and talk to us in more detail later, then please do so. So, what exactly was the starting point? Where did we start this process? So what you're seeing here is the as is. This is the interaction and the process flow between the various parties in providing patient care. And in this case, if we focus in, we are talking about a specific provider of GP services. Can I say the name?
Yeah.
Yeah. Malling Health, well respected, trusted provider of GP services. And the exam question is, how do I improve patient care for patients that are coming into the Malling Health scenario? So this is how it works today. But what we did is we came in with Ummanu and tried to effectively implement the vision that they had, which is a vision of, hey, the patient doesn't need to come in to a GP. Perhaps they can have a great experience, and the care that they provide, or they receive rather, can be enabled through the telemedicine concept and the way that works out. So this was the end state. This is what we wanted to achieve. Now, this is where the slides get a little bit more technical. It's that man over there that you have to thank for this particular slide. So please come find me later. But the next bit of information that is critical to this is leveraging these folks. So we decided, or rather, Ummanu already had a relationship with AWS. They came to us because of our experience not only with InterSystems but with AWS, and we were able to bring the two together. So this is a real first for us, and I think probably a real first for healthcare in the UK generally. It's probably not too much of a stretch to say that many trusts in the UK have a cloud-first strategy, but a much smaller of those proportion of those trusts actually execute on that strategy and leverage these sorts of providers. So the key message here is use of InterSystems Iris for Health, use of the AWS stack, integration of data flow without human intervention between the Ummanu platform and the advanced Adastra platform. This is an even more technical slide, but again, the idea here is to showcase the complexity of this. What I've just said sounds very simple, but if you want to use the stack and its features to the extent that's required, you have to have some experience in this arena. And again, the idea is not for me to go through this, but please come to us afterwards if you want to know a little bit more about how we went about this, achieving it in a very short time frame, which I'm glad you mentioned. So if the previous slide was about the flow, this slide is showing you the platform. So again, same message. It sounds easy, but actually it was somewhat challenging to achieve the very, very stringent timelines that Ummanu placed on us, and the need to get this live.
Okay, so thank you, Shaz. As Shaz was talking, this was what we call business as usual scenario. What the system that our clients are using as their core case management system is Adastra. You probably heard the name because of the recent cyber attack on Adastra. So on August 4th, we noticed something strange going on with our clients. We saw that there were no new cases coming in. When we contacted our clients, we understood that their core system, Adastra, was down due to cyber attack, and that they were instructed by NHS to resort to pen and paper for unlimited period of time. I would say that some of these clients are still working with pen and paper. So immediately we set up a war room with our top management together with our clients and the guys from Integrella. And in the following hours, that was 4th of August, that was Thursday. And we know that out of hours providers during the weekends is their top load in terms of number of consultations. So in the following hours, we redesigned the process. We activated new features. We did some development, testing, QA, deployment, training, and creating training material. So after working continuously through that weekend, by Saturday, the 6th of August, we had a new process in place overriding Adastra. So we had for our customer a full case management process using our system, InterSystems, with the help of the guys from Integrella working shoulder to shoulder with us to make sure that it happened within just 2 days. So the flexibility of the system, that's Arun, right? The flexibility of the platform together with the commitment and the can-do approach made us succeed in this challenge. And it was amazing teamwork. Back to you.
Thank you. So, I mean, there's a good couple of screenshots from what was in the public domain. What I find quite interesting is that many clients are still in that situation. So, the fact that we were able to resolve that in such a short period of time was great. So again, just to wind the clock back, this was after the Ummanu solution went live. This was how we were working. This was pre-outage. So what did the outage do? So this is what the outage did. It knocked out that whole bottom arm of the flow that patients were expecting to experience. And what we were able to do with the guys from Ummanu is change that last one. So you could probably ask yourself the question, do you even need the bottom arm at all? And of course, that's a question I can have off microphone, and we'll have a conversation off mic. But what we were able to do is, within a very short period of time, is preserve that continuity of patient care, which of course is ultimately why we're all here.
If you're a health organization or working for a health organization, at the moment we are focusing on out-of-hours providers, but in Israel we do this kind of productivity increase with secondary care, with ambulance services. So please do approach our stall, and we'd love to talk and tell you all about it.
Yep, thank you. And if you would like to talk to us about our experience with the InterSystems technology stack, what we're doing at the moment in terms of implementing it across a variety of settings, then please come and talk to us. We'll happily tell you about what we're doing, what we're planning to do. Thank you for your attention.
Thank you so much.